So um, you lost your job as a nurse, um, and now obviously you'd like to practice nursing again. Why is it that you can't?
Literally because of this mandate. Nothing else. It's not that I was horrible at my job. It's not that I do not believe in science. It's not that I do not believe in vaccines. um I encourage anyone to get vaccinated, especially those that are vulnerable and at a high risk. Or so the only reason why I'm not able to work here specifically in Ontario, Canada, is due to the mandates. If I was anywhere else, like Alberta, like anywhere else around the world, really, I could be working. But I guess I can work at McDonald's right now
So how
instead
do you
of.
get back into nursing? I mean, what's your strategy to get back? Would you, is there a facility that you could work at despite not revealing your status?
I have applied to over 200 jobs here in Ontario. I received about I actually went through many interviews, and the only barrier to me getting a job was literally when they would ask me for my vaccination status. So the only way I could get back to work is if these mandates drop, and I would be happy, more than happy, to help mitigate the shortages that we're having. I would be happy to help even the ERs that are closing down. Um, if they show that, if the science shows that I'm not putting anyone at risk, I would be more than happy to get back in there. I miss working with my patients. I miss my colleagues. I like, this is not an easy profession. It's a profession that's very close to my heart. I'm very passionate about helping people. I actually wanted to volunteer when I retire to travel back to Africa, where I'm from,
Mhm.
and help some people there. So
What's your life been like since March when you lost your job? What have you been doing? What's the experience been?
I'm pretty much almost homeless now. Because I lost my job. What people don't understand is I actually put myself through school. I did not have rich parents that paid for my schooling. So as an immigrant to this country, actually, after I got my citizenship, I was able to apply for a student loan. But that's money that I still need to pay back, right? So life has been more than stressful. I've actually been in the ER a few times due to the stress that I've gone through, not due to COVID, but due to the stress that I've gone through over the year. I lost my home. I was living in a nice condo um, near the hospital, so I lost my home. I lost my car. I it's been rough. It's been
So
rough.
what's the path back into nursing? I mean, you see that there's a shortage going on. What goes through your mind when you see that right now Ontario is short of nurses?
My heart breaks. My heart breaks for the patients, because I mean, I could be a patient in the ER, right? That means I'm now having to either go somewhere further. If the ER near me is closed, I'm now having to go further for healthcare. When I get there, I'm probably now going to have to wait even longer due to a shortage of staff. So my heart truly breaks for the public and my colleagues. Like, our job is stressful, and to have to take on an even heavier load is not safe. It's not safe for the nurse, and it's not safe for the patient. So if they can do anything, even if it helps 1%, 2%, let's do it.
And how many nurses do you know of who are in your position, who are in a similar position?
I know, as far as close friends, I know two nurses. Like maybe out of like 10 of my friends, two of us are in the same position that I'm in. I know some other nurses actually in America that I'm friends with. but their situation was a bit different. They were able to get exemptions, which we do not have here in Ontario, Canada.
It's quite an experience, and all this is happening while ERs are being closed. I mean, you see the news just like everybody else that some ERs have made the decision that they have to close.
Yeah, I mean, I'm honestly quite disappointed in our leaders. They can do something about it, and they're not. Clearly, there's other provinces where they have dropped the mandate. So if you care about the public and you care about nurses, the so-called heroes that we were, then you would do something. If you can look at the science, and it shows that nurses or staff that are unvaccinated do not put patients at risk,
Mhm.
especially at the age of Omicron. If it's safe for us to go back to work, then why not?
Sharon-Rose, last question. The Ontario Nurses Association is pretty adamant that it prefers to have nurses who are vaccinated and that there's a mandate. So how do you respond to that, given that you want to return to your profession?
That's another thing that has been quite disappointing. What have actually been more disappointing overall is that I see the politics is getting into healthcare. Our union seems to be lining up with certain politicians. I have an issue with that personally. And once you start lining up with certain politicians, your policies start to align with those of that political stance, right?
So you have an
think
issue with the association, obviously.
Yeah, I guess I have an issue with many people, but there's been some great work though that ONA has done. I know as far as the medical exemption, there was just a court case. I saw an email that not maybe a month ago or not too long ago, where they did go to court and fight for the medical exemptions to happen. So I believe that's now going to start rolling down. So they're doing some good things, but there are some things that they could do better.
Well, we'll see definitely how this all plays out and how many people are affected. Sharon-Rose Nyambiya, thank you very much.
Thank you.